Hello, good afternoon. My name is Dr. Chudi Ufundu of Snowspirations Global Health Solutions. Thank you and welcome to our open clinic this afternoon. Today, we're going to look at the important worry and concerns regarding fertility treatment, especially IVF, and possibility of developing cancer. Can fertility treatment, especially IVF treatment, be a risk factor to developing cancer? Very genuine concern, very genuine issue we need to trash out this afternoon. So we're going to look at the possibility if there is a connection between treatment with IVF and immediate cancer risk or later in the future. So please, when you join, I need to know who you are. I need to know your location. And once we have a good number, we're going to start. I intend to spend about 30 minutes. And after this 30 minutes, I'm going to spend another 30 minutes in Facebook. So if you're not able to join the YouTube, you can join in Facebook and we can have meaningful conversations. So please quickly make yourself comfortable and announce your name and location. And we're going to start very, very, very soon. We're talking about IVF and other fertility treatments, especially fertility treatments that will require taking hormonal drugs. Would they lead to possibility of developing cancer right now or later in the future? That's what we're going to talk about. So I can see Chinyere. Chinyere, thank you so much. Please, once you join, go to the comment section and drop your name and your location. Once I have a good number, I'm going to start. We're planning to spend 30 minutes. So my presentation will come first. After my presentation, you will have opportunity to ask me questions one-on-one. Okay, thank you so much for coming. Now, for the month of August, we've actually selected a topic for our masterclass. Our masterclass for the month of August will be on fertility, SGHS Couples Fertility Summit. So make sure you make provisions to attend. It's going to be on the 27th of this month, 9 p.m. Nigerian time. Registration is currently ongoing, so please register as soon as possible so we can all have meaningful input. So let's start. Once you join, you just continue. So the question is, does IVF increase your chances of getting gynecological cancers? So when we talk about gynecological cancers, we're going to focus on cancers that predominantly affect the gynecological system. So the connection is, can IVF, based on frequency and if you've done it in the past, predispose you to having breast cancer, predispose you to having cervical cancer, predispose you to having ovarian cancer or uterine cancer? So that's what we're going to try to dissect. Now, previously, there are a couple of data that suggested that fertility drugs, which is part of what we use in IVF treatment, will increase your risk of developing breast, uterine, and ovarian cancer. This is in the past. So the studies believe that when a woman is exposed to these fertility drugs through IVF, there will be a transient increase in the risk of developing breast cancer, uterine cancer, and ovarian cancer within the first year of treatment. This was in the past. However, what we know today, there is no strong evidence strongly in support of the theory that when you go for IVF, you have marked increase in possibility of developing cancer. Now, the concern is plausible. So plausible means when you go for fertility treatment, you're exposed to unnaturally higher level of hormones, especially estrogen and progesterone. So when we talk about cancers, it's actually estrogen and progesterone that play a role in cancer development. And when you go for IVF treatment, we're going to give you a whole lot of estrogen and progesterone on higher doses through the process of what we call superovulation or hyperstimulation. So it makes sense for some people to think that if we increase the dosage, if we increase the duration of all this hormonal treatment in IVF, we might likely inadvertently increase the risk factor of developing cancer. Now, this is just a theory. You know, in medical field, there's theories, then there is hypothesis, then we have to confirm it to be solid. Right now, we don't have enough evidence to support this. Now, there was a particular study in Britain in a couple of years ago. They looked at 250,000 women regarding their rate of developing ovarian and breast cancer after going for IVF, and the data they got was inconsistent. Now, they repeated another research in Dutch, which is Netherlands, regarding the consequences of developing cancer after you've gone through IVF. So they looked at 19,146 women who went for IVF. And out of these 19,146 women, only 13 experienced ovarian cancer. So the question is, out of 19,000, almost 20,000, and if 30 people develop ovarian cancer, was that cancer related to the IVF treatment they did? So the question is, we can't really tell, because the most important aspect of medical field is clinical practice. So we cannot categorically confirm the link between IVF treatment and cancer, because if we really do the clinical trial, we have to divide women into people that will go for IVF, become pregnant, so we can have a control. But what we know today, there is no evidence to support the claim that increase in ovarian cancer was possibly due to the IVF treatment they had in the past. So until proven otherwise, no convincing evidence that IVF might likely lead to cancer down the road. So what are we supposed to do in this regards? Now, a couple of countries actually keep data regarding the medications and the treatment they give to their citizens. Example is Sweden and England. So they keep records. So they've actually checked this record and they couldn't see any connection between breast cancer, ovarian cancer, uterine cancer, and IVF. So we're talking about a country that have the data. So the most important thing you have to understand is to make sure, if you are going through IVF, if you are going through fertility treatment, if you are having infertility problem, it's important you consult a qualified, experienced, evidence-based provider. The reason is because the drugs we're going to give you for IVF treatment is going to be followed up. It's going to be monitored so that they won't predispose you to the dosage that will likely lead to problems. So you need to, first of all, establish with an IVF provider who has the experience, and they will give you the dosage of the drugs that will be good for you. Now, we haven't really received data from women that have gone for series of IVF treatments. So depending on the number of times you've gone for IVF treatment, we haven't really tied the relationship between that and developing cancer. We don't know. So in medical field, when we don't know, we don't go, saying things we don't know. So as of now, the studies are still ongoing, so nobody can come out to claim, oh, because I went for IVF, then I developed cancer, and in that regards, I'm not going to go for IVF again. Life is all about risk. Life is all about taking your chances. If IVF, it's what you need to start your family, you still have to do that. There are still so many people that will develop cancer even when they've done everything right, but you need to be more careful. Now, some women might have family history of cancers even before the IVF. So if they have such, when you take those artificial hormonal drugs, especially estrogen, it will increase the chances, it will increase the probability of developing cancer. So there are some women that probably their mother, their grandmother, their father, or whoever in their family had cancer history. So any form of cancer in the family will predispose you to developing cancer. So if we give you those drugs, which we use in IVF, it might likely increase the possibility, the chances of developing cancer. So it's important that if you are going for any treatment, there are a couple of steps you need to take. There are a couple of precautionary measures you need to make sure you abide by. You need to work with your provider. You need to make sure that they know everything about you. You need to give them important history about your family. You need to go for history of cancer. You need to be tested. There are a couple of cancers we can actually check. So assuming your mother died of breast cancer, assuming your daddy died of prostate cancer, and you want to start your family, and it's not happening, and you need to go for IVF. When you meet your IVF provider, you have to provide that information. Now, you have to approach successful fertility treatments, successful fertility clinics, so they will do everything possible to reduce the possibility of having a lot of exposure to these hormones. There are some women that have gone for 5 IVFs. There are some women that have gone for 4 IVFs, 6 IVFs. If you go to a successful practitioner, they can actually do it once. So the question is, the more you keep exposing yourself, the more the likelihood is going to happen. That's nature. Just like the more you keep exposing yourself to alcohol, to smoking, and to lack of exercise, and to obesity, the more you are increasing the possibility of developing medical problems. So if we can reduce the frequency, if we can reduce the sections of IVF we go for, we would have inadvertently reduced the possibility of developing cancer. So inform your medical provider, go to a very good fertility clinic. There are a couple of fertility treatments we can actually try before we eventually go for IVF. IVF is the last option. IVF is not the first. So if you go to a very good fertility outlet, they might actually start with normal fertility drugs. They can also try IUI, and if it fails, then they can now go to IVF. So IVF should not be done easily. IVF should be done under a controlled environment so that we'll be in a better position to make sure we prevent anything that will predispose us to developing cancer. So in summary, as of today, there is no concrete evidence to support the fact that if you go for IVF, you will develop cancer, or going for IVF will increase the risk factor of developing cancer. But here's the caveat. Until today, the researchers are still ongoing. So possibilities might be there, but right now we don't have a connection yet. So be careful what you do. If you have a family history of cancer, discuss with your doctor. If you're not living right, live right, eat right, exercise, watch your body weight, and overall, just avoid so many carcinogens out there. There are so many carcinogens out there that will predispose you to having cancer. There are also some cancers that have sexual history connection, like HPV, human papillomavirus. So you need to be careful. If you are careful, if you live right, there are a couple of things you can prevent, but there are things that no matter what you do, it will still happen. But as of today, there is no connection between IVF and cancer development in gynecological case. So no connection between IVF development and development of breast cancer, uterine cancer, and ovarian cancer. So that's my presentation. I'm going to quickly open the clinic so you have an opportunity to ask your questions. So please feel free and ask your questions. Admin, you can generate questions too. So Chinyere and Onyi, you guys can generate about 3 questions each, and I'll provide you feedbacks. Okay. What's the ideal number of times a woman should go for IVF? So this is going to be the decision the IVF provider will give. Now, here's the deal. There is no upper limit. There is no lower limit. But please, don't be the person that will be calling the odds. So what do I mean by that? If you had one IVF in 2023 and unfortunately it failed, personally, what would be more ideal is to go for one more time. Ideally. Now, before you go for that repeat IVF, we would have done a lot of follow-up, would have done a lot of investigations, would have done a lot of reviews to see what we can do differently. Now, if you are going for IVF, you have to be very firm. Whatever dosage we gave you, whatever drug we gave you, whatever number of days you're supposed to take, you have to follow them religiously. Now, we've seen women that abuse Clomid and other fertility drugs. When you do that, you're increasing your chance of developing IVF or of developing cancer. So the right thing to do is to allow the IVF provider to decide the number of cycles you will need. And most times the providers will rope you in because they will give you an impression that if this one fails, we're going to give you a discount. So it's not about the quantity, it's about quality. So there is no standard, oh, don't go for IVF more than 2 times, don't go for IVF more than 5 times. It depends on your history. It depends on your age. It depends on your family history of cancer. So assuming your mother had breast cancer or any of those cancers, and you still want to start your family, there are other options of starting your family that will remove you from being exposed to those drugs. So it's all individualized. Okay, can a woman still have spontaneous pregnancy after IVF? 100%. There are so many women that their IVF failed and they continued practicing PPP and they got a positive pregnancy test. So the answer is yes, 100%. So the fact IVF failed doesn't mean you can still become pregnant. Your IVF might succeed, your IVF might fail, and natural pregnancy can still happen. 100%. Okay, what about IUI? IUI is also a type of assisted reproductive technique. So in IUI, what we principally do is to confirm that the woman is ovulating. Then we make sure that the partner has good sperm. Then we collect the sperm and we introduce the sperm into the womb. That's why it's called intrauterine insemination. So A stepwise approach in fertility management is to first of all try the drugs. Then if the drugs are not working, they can graduate to IUI. IUI can be done with your natural cycle, or we can induce your cycle, or we can use any other options. Then if it fails, we can now go to IVF. So IVF is the very last option in fertility treatment. Okay? What's the best option for a woman that have recurrent miscarriages like 5 times? IVF. Now, if we are doing this IVF, we're going to check a couple of parameters, because if your problem is not becoming pregnant, if your problem is just sustaining the pregnancy up to 10, then we need to look at things logically. If there is a factor in your womb, in your body, stopping you from carrying your baby up to 10, which is 37 weeks, then your best option is to go for surrogacy or adoption. Unfortunately, there are some women in this category. There are some women that have hostile womb. No matter what happens, once the pregnancy gets up to 14, 12 weeks, they will miscarry the pregnancy. If you happen to find yourself in this category, in as much as it will be very difficult for you to accept, then you need to prepare and go for surrogacy. So in surrogacy, another woman will carry your baby. So it can still be your ex, it can still be your partner's sperm, but you're not going to be the person that will carry the baby in your belly. I love all those questions. Can a woman having adenomyosis go for IVF? Actually, if you have adenomyosis and it's severe, the best option for you to go for is IVF. So if you have any gynecological problem that will affect your ability of naturally achieving pregnancy, it's always better to go for IVF. Okay. No. Because IUI will not increase. Like IVF, I told you guys, there is no evidence as of today. So if there is no evidence as of today regarding IVF, of course, IUI will also not have such, because in IUI, our main aim is to make sure the woman is ovulating. So in IUI, you might not actually need any drug. We just need to get the sperm and introduce the sperm inside your womb. The women that are having problems with ovulation, we can give them ovulation induction drugs. But if you're not having problems with your ovulation, we're just going to target the time you will likely ovulate. Then we produce the sperm, hoping that pregnancy will happen. So the chances of being exposed to cancer if you're going for IUI, it's lesser if there is a chance in IVF. Okay? Can a woman's body weight determine the outcome of success? Yes. Anytime you are getting ready to become pregnant, whether natural pregnancy or assisted reproductive technique, make sure your BMI is within the normal range. The normal BMI is 18.5 to 24.9. So if your body weight is below, which is underweight, or if your body weight is overweight or obesity, it will likely lead to delay in becoming pregnant. So it's always ideal to have an ideal body weight, to have a normal body weight. Normal body weight is a body weight that will give you a BMI of 18.5 to 24.9. Is IVF for every woman believing for baby? No, IVF is only applicable when the other methods of fertility management fail. So if drug treatment failed, if IUI failed, and it continues to fail, then IVF will come in. So IVF is the last bus stop. IVF is not the first. So you don't just start and say, oh, I want to go for IVF. No, IVF will come in if the other ones fail to give out good outcome. Okay? What's the best advice for a woman already that had failed IVF? So unfortunately, it's very painful. So you're going to be in a very bad place. But after you're done crying and doing all that, you have to go to the IVF provider with your partner. They have to do a lot of tests. They have to do a lot of investigations. And of course, they have to review their process. So we have to check and see if there are things we can do differently. Don't just plan to go for another one if they haven't done the investigations and the assessment and all that, and give you a report. You need an IVF report. We need to see what we can do differently before you can go for another one. And of course, you have to be open to use donor eggs and donor sperm. Okay? All right. Keep asking your questions. Keep asking your questions. If you have any, I'll provide you feedbacks. Okay. Good questions for you guys this afternoon. Remember to piggyback to Facebook. Join me in Facebook immediately. I'm going to give a repeat talk on this particular topic. Remember to register for the masterclass. It's already open. The masterclass is going to be on the 27th of this month. So I encourage you to register today. The registration is open. Okay. If we don't have any other question, then we will get ready to, go over to Facebook and continue the conversation. So do we have any other question? Ask your questions, please. You have to do what you have to do. If IVF is your only chance of starting your family, you still have to go. You cannot allow the fear of, even people that have cancer can still start their family. So the fact you have cancer will not stop you from becoming a mother, will not stop you from becoming a father. There are things we need to do, and we do them differently. And you can still defeat cancer, and you can still have your family. If Clomid disposes a woman to cancer, can the same be said about the drugs administered to women during IVF? Of course, Clomid is a fertility drug. So Clomid is a drug you don't want to abuse. So in the same vein, all the drugs used in IVF must be carefully administered, carefully monitored, carefully followed. You're not supposed to be the person that will determine. We determine the dosage that will work for you. So the same way you should avoid abusing Clomid, the same way you should also avoid abusing any fertility drug out there. Because guess what? When we are giving you fertility drugs, predominantly all of them are made up of progesterone and estrogen. So if we're giving you progesterone and estrogen, they are artificial progesterone and estrogen. So they can disrupt the normal balance in your body and predispose you to developing cancer. So the answer is yes. Okay? Do we have any other question? Beautiful questions from you guys. I love all the questions. Keep asking your questions, please. All right, so it looks like we are done with the questions today. So thank you so much for coming. My next clinic will be on Tuesday in YouTube. Tuesday should be 6:30 p.m. Eastern time US, and that should be 11:30 p.m. Nigerian. So the next clinic in this particular YouTube channel will be on Tuesday. Now, if today is the first day of attending my clinic, I genuinely appreciate you for dropping by. Please, before you go, subscribe. For you to subscribe, click on that button. When you click on the button, it's going to pop up. You're going to click on it and make sure you set your notifications to inform you when I'm coming live. Okay? So until I see you during IVF treatment, there are treatments the male is also given. It depends on the outcome of the fertility assessment in the male. So if the male's sperm is okay, then nothing. We just collect the sperm. We can only give the man treatment if the man's sperm is having problems or he's got other medical problems that will affect the male pattern of fertility. If the man is okay, if we check the sperm is good, the general outlook of the man's fertility assessment is good, then we're not going to bother. We can only give him treatment if something is wrong. For example, if the hormones are, out of place, like testosterone and all that, we can do that before we go. But if not, there is no role a man plays in IVF except to bring the sperm. Okay. All right. And great attendance. We have 7 people in the clinic. That's actually very encouraging. Most times we just have about 3 people. So it's a very important topic. Click on the link. Make sure you share with your channel. If you're sitting on the, on the fence, you're worried, you're fearful if you should go for IVF or not, remember, life is all about gamble. Life is all about taking risk. Going for IVF is a very, very big risk you have to take for your family because you have to start your family any which way. You cannot allow fear to stop you. Now, there are some people that will obviously make the hard decision of going for surrogacy or an adoption. So if you don't want to be exposed to, all those drug treatment that might predispose you to developing cancer, then adoption and surrogacy is your best option. Okay? All right. So thank you so much for coming. I'm going to transition to Facebook and we continue our conversation. So I'll see you guys shortly in Facebook. So Chinyere Anoni, please, let's quickly move to Facebook so we can continue the conversation. Thank you guys for coming and enjoy the rest of your evening. Bye-bye for now.